Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. And today we are in the office and there is a session going on outside, so that is what you're hearing in the background. They are getting after it. So we will just continue on. Today we are doing a golf episode about sway. It is a swing characteristic we see from the address to the top of the backswing. So we're going to dive into the details of what sway is. We're going to understand it. We're going to identify different causes of it. And then we're going to come up with, and I'm going to take you through some progressions that we use in the office here and on the gym floor to address any of the movement or mobility issues that we find that are associated with sway, and the same thing with any stability issues that we find that are associated with sway. And then we can talk a little bit about some swing drills that we can compound into this, where once we start building in some mobility back in, we start understanding some weight shift things, is that we take that back to the golf course. And again, just simple little drills here to help make sure that you know what it feels like to not sway in the backswing, and then you can take it from there. All right. And then, we'll talk a little bit about the theory and the ideas behind addressing the body and the biomechanics first, and then coupling that into golf, swing, and coaching. So first thing, we're going to start with a little short video here that I'm going to clip in that's on my YouTube channel that is addressing and kind of talking about the different components of sway, what it looks like from a golfer's perspective and what it looks like from a biomechanics perspective.
So, what is sway in the golf swing? Well, sway is if we draw our lines, when we come up into our backswing here, sway is where we break that line with our backside hip. Now, this can be either exaggerated or slight. So what are some things that we're looking for as possible reasons to create this compensation? Well, one thing is just not understanding that we're doing it or not knowing that we're doing it, right? So it really helps to take some video to understand that. Otherwise, we need to look at the hips first. So with the hips, we want to know, can we create internal rotation on this backside hip, and can we create external rotation on this backside hip to create that pelvic rotation to get into the backswing? TPI has a test to look exactly for this. Can we get 60 degrees of internal rotation here and 60 degrees of external rotation here? If we cannot do that, then we might compensate, instead of rotating here, that instead we take our hips and we just push them this way. Now, besides significant reductions in power production by not being able to rotate in our hips, if we are not rotating in our hips and swaying, we are losing the ability to create recoil and stretch throughout our thoracic spine and our pelvis to create that X factor to come down with more power, right? So if we can stay tall and strong, not sway into the backswing, we can then use that stretch shortening through here as opposed to breaking that stretch shortening as we sway.
Okay, so as we talked about in the video before, we need to first look at, typically it comes to the hips when we're going to look at that lateral sway, right? That lateral motion at the hips. We need to know, is that happening because the hips themselves and the pelvis really doesn't want to rotate on top of the hips? Remember, we're in a closed chain, so it's more so we can think of it as the pelvis rotating on top of the stable femur. Now, if it doesn't want to do that, then certain compensations will pop up just about everywhere. One of them could be that lateral sway. All right, so we need to look at internal rotation of that backside leg and external rotation of that lead side leg from the address to the top of the backswing to make sure that we are able to actually make that happen. Now, on top of this, we need to just build in this lateral shifting back in. We do this, we start on the ground on our back usually or on our sides. Really a lot of great stuff that we can do here, and this isn't just for fixing sway. There's a ton of people that need to learn how to shift their weight from side to side, and it's not so simple as it sounds, right? We're being very precise when we say that. We need to be able to shift. We need to nutate or counter-nutate the sacrum. We need the pelvis to be able to flex or extend, to abduct or adduct, to internally rotate and externally rotate as these things happen, right? This is called relative motion on top of a femur. Again, just about everybody lacks good motion here. So this is where we start on the ground, start working through some things. And then we can start building that in. So once we truly get the mobility back, we start activating certain muscles to push us into this range of motion right? So that we can actually control it. So we start trying to do the same thing from more of a passive standpoint into now more of an active standpoint, where we're getting precise muscles to start turning on and very precise muscles to start turning off, which is equally important to get this shift to start happening again. And then we can take that to where we get back up on our feet and start drilling and doing exercises now more in a standing position. Again, not just getting the mobility, not just testing and improving mobility in the standing position, but also improving which muscles we are using to do and create this motion on the hips as we're standing in that golf posture and things like that, right? Because it's not just about being able to lay on the ground and show that I can rotate the hips in the adequate degrees that they need, because we need to actually actively have that golfer contract muscles and relax certain muscles to get that range of motion as they're in their backswing, right? So we incorporate all of this in together as we build golfers back up when we're addressing certain movement restrictions and certain swing characteristics like sway. So let's first talk about a couple exercises that we can use. The first one would be this 90-90 hamstring bridge, right? And I'll show this on the screen. So let's just dive into actually each exercise individually here. Okay, so for this first drill, this is a supine 90-90 hamstring bridge. There's different variations of it, but for this one here, we just have a foam roller. You can put anything small between your knees there, and you're not supposed to squeeze that too hard, really. Just think about like a 1 or 2 out of 10 pressure. Just want to make sure that we're keeping a little bit of pressure into that so that we don't have to think too hard about where our knees are or keeping them in line with our ankles or anything like that. Okay, so from here, the idea is to get your feet on the wall. Your knees should be at 90 degrees, your hips should be at about 90 degrees. And then from here, we're simply just doing a little posterior tilt at the pelvis, okay? So what that means is I want you to think about scraping your tailbone off of the floor just slightly, just about an inch, just like that there, right? So let's see if you can find it again, where you'll see your knees just raise off the ground or towards the ceiling there ever so slightly. That means that we've posterior tilted a little bit. Think about dragging your heels down that wall, but let the friction hold them there. And you see there, we just raised up ever so slightly. I'm saying, hey, we got to point and scrape our heels down the wall, or imagine doing that. That'll activate the hamstrings, and then we're just hanging out there. This isn't meant to be some crazy hard exercise. We just want to activate the hamstrings a little bit to get that pelvis back into a little bit of a posterior tilt. Now, we can make this a little bit harder by, say, extending one leg towards the ceiling. So in this case, we would keep our left foot on the wall, and we take our right one off, and we just extend and have a straight leg here pointing towards the ceiling, and we can keep that foam roller right there. And we're just going to hold in this position here, and we just breathe. Slow in through the nose, very, very slow out through the mouth. Feel the core working to push the air out. Maintain some of that tension. Keep your ribs tucked down, and then breathe back in through your nose, right? And then we're just holding that for 30, 40, 45 seconds, letting that hamstring activate on one side or the other, depending on what we find, or we'll just do both. Okay, so this is one way we start to reorient that pelvis back into that posterior tilt, which frees up a ton of range of motion right then and there if we're able to do that correctly, and if that's something that that patient or client needed, right? So we just start using those hamstrings, not to flex the knee, but that other job that they have, which is orienting that pelvis and pulling that pelvis backwards a little bit out of an excessive anterior tilt, which a lot of times we'll find. Okay, so here we're going to work on a little bit of mobility in the hips, getting certain muscles to turn on. That's really important here, and then certain muscles to turn off. So in this case, if we're going to focus on the backswing, now it depends on what the exam shows, then that's the side we'll work on. But in this case, we would flip me over onto the other side if we really wanted to work external rotation on the left side and internal rotation on the right. But so let's just imagine I was flipped over. And in this case, we're going to work on getting that glute max on the top side to start working, and then we can from there get some external rotation from that, and we have our foot on the ground creating a closed chain, right, so that pelvis can stay in place. We have the glute working on the pelvis and the femur to create external rotation, right? More than anything, the glute max creates external rotation of the hip. Now again, imagine I was flipped over, and that would be external rotation of that left side hip. Sorry for that. Right, so moving forward, what this drill is, we're going to move our top side knee forward in space. Kind of think about it almost, you can let it kind of hang out on this bottom side leg, or you can put a little ball there if you want, but just roll that knee forward past your bottom side knee. Don't let your low back come with it, right? So when we're doing this, I don't want to see that low back just rotating and your chest kind of dropping towards the ground. I want most of this coming right from the hip capsule. So there I'm showing what not to do. Instead, I want you to push that knee forward. Good. We feel it coming all from the hip. I'm staying in line and straight everywhere. And then from here, we're going to push or pull that knee up towards the opposite kind of thing, top corner of the room. That really starts to activate that glute max, right? So here we're getting mobility of that top side hip into external rotation by kind of pushing that hip forward past the other side of the pelvis, and then really getting that glute to activate in that position, right? In that position, we get that glute to work into some ER, and we're naturally, if this pelvis here is forward, we're getting internal rotation of this bottom side hip, right? And so if we're flipped over on the other side, that is exactly what the backswing is where we're getting external rotation of that left side. We're using the glute specifically to do it, which is exactly what we want, and then we're getting some internal rotation at the same time of the, now in that case would be the right side pelvis and hip. This is a med ball pullback. You can see this is kind of mimicking a backswing, and there's a few interesting things that we can point out in this drill. So first, as I come back, you can see we're trying to keep the back glute, especially the right glute here, up against the wall there, right? So we're kind of in our starting set posture. Imagine you're holding a 5-iron, just that 5-iron is inside a medicine ball. Keep it pretty light. We're going to pull back, let the ball touch the wall, and then control that on the way back down. You can see what's happening here at my knee. So again, we can replace the med ball with just a light dumbbell. But you see as I come back, this lead side knee, this is kind of a reflexive movement here that happens where that lead side knee will actually, in a planted foot, start to externally rotate. So what's really happening here is this hip is starting to externally rotate, and we see that at the knee, right? And then with a planted foot, that's what happens. That knee pops out a little bit to create some stability, create some force. And what's happening there is we're actually using the left side glute to externally rotate that hip, which is pushing us and pulling us into that backswing there. Again, now with the dumbbell, you see that knee starts to pop up and that pelvis is moving towards the right side. But again, with a planted right foot, we're getting internal rotation here. So this drill, I want you to focus on just keeping your hips up against the wall, stay in your posture, and then move into a backswing. And think about using your obliques and your core to do so, but realize also that you're going to be working on some internal external rotation here at the hips as well. And again, these are all motions that we need, and they should hopefully be pretty fluid in our backswing. So a great way to translate a little bit of mobility work into a stability and strength exercise. So we've talked a little bit about the biomechanics, how we address some of that with a few exercises that we're building a little bit on top of each other when looking at sway. Now these are just a few of many ways that we can go to start addressing the actual biomechanics, the bony positioning, and then the different muscle lengths, tension, tightness, things like that that are associated with sway. And again, we have a lot more testing that we would do to really figure out the details of every single joint, ligament, bone, tendon, everything that's going on that could lead to sway, could lead to body posture positions that either make sway kind of the primary movement option or are just limiting us from actively preventing sway, right? So like we had talked about with that backside hip internal rotation, if we don't have it, then we're probably going to sway more than we are going to actually kind of post up through that leg and then rotate through that leg. And again, other things is like being able to shift weight in our pelvis. This is common. This is something that usually does not get worked on in your typical PT or chiro setting that might be doing sports medicine or rehab, where we kind of just look at the hips and the hip joint, but we don't really look at the pelvis and how the pelvis actually moves and operates on top of the hips. Right, so this is just a few exercises, progressions that we use to, that you might think to use to start moving in that direction. Now, if we look at the actual swing drills that we can do here, first we would draw some lines to identify the sway in the first place. We do that biomechanics exam to figure out why you're swinging the way you are, and then if we identified some movement options or some deficiencies in movement options in that biomechanics TPI screen, we would address them. But we can also give you some hints towards bringing what we are working on in the gym and on the rehab floor to the practice range, right? So that you can start taking these motions we're building into you and feel what it feels like to actually do it in the golf swing, right? So just some simple drills here to start translating a little bit. And then, of course, always recommend to go to your golf professional, swing coach, and let them take it from there, right? So once we give you the movement options, we let the swing coaches really start to get into the nitty-gritties about the actual swing timing and swing mechanics. But if we're to kind of describe two golf drills here that we can do that we're working on the swing, One would be a braced leg backswing. For this one, very simple. You can actually use a band around your knees to do this. You've seen this in some videos before where you have like a rubber band around your knees and it's trying to pull your knees together. Here you reflexively will push your knees back out. What you're using there should be, if we put you back biomechanically in a good position, should be your glute max on both sides to externally rotate your hips, right? And what that looks like at the knee is just those knees going outward, right, towards the side. We don't want to do this excessively. All we want is just a little bit of tension in that direction on both sides. So just a little bit of tension, feeling your knees start to kind of pull away from each other like they're the same side of a magnet, right? That kind of pushes away from each other. That's what you want to feel. And then maintain that tension, that pressure in your backswing, right? So you can actually use a band and then pull out against the band around your knees, or just think in your head, imagine there's a band pulling your knees together, push your knees back apart from each other, maintain that tension into your backswing, and then downswing. If you do that correctly, it should be pretty hard to actually sway the hips back as you do that, right? If you're keeping that tension in both sides, you're going to be pretty resolute. You're going to stand pretty strong and not sway at the hips, right? So this is a starting point for working on sway in the golf swing after we've given you back the movement variability, the movement options at the hips and the pelvis. Another drill we can do, foot pressure golf ball drill. What this is we simply just stand with the golf ball on the inside edge of your back foot, right? So we are kind of tilted with our inside edge on top of a golf ball. And then what we want to do here is put pressure into that ball. Think about nailing that ball into the ground. If at any time here, the outside edge of your foot is able to actually drop down and you feel weight pushing into the outside edge, that's no good, right? So what we want to feel is that we're putting pressure onto the inside edge of our foot right into that golf ball, right? So that outside heel or edge should almost be floating a little bit. And if any time we get lazy and we stop pushing, actively pushing that inside edge of our foot into the ground, then our outside edge of the foot will kind of turn and touch and contact the ground, and no good there. So if we're maintaining pressure on the inside edge of our foot into that golf ball, it's really easy to kind of slip that ankle over the top and put all the pressure on the outside edge. We're working really hard not to do that. If we're doing that and putting pressure through that inside edge of the foot, then we should not be swaying, right? We're kind of learning to post on that backside hip, and then instead of swaying, we're forced now to rotate over that hip. And if we've done our job of getting that variability and that mobility back in that hip, then we shouldn't have too much of an issue doing that. So we've taken a look at what sway really is, how the biomechanics and our mobility and stability affects the reason we are swaying in the first place. We looked at some biomechanical drills, some exercise drills to start addressing some things, some mobility and stability issues. We looked at a couple golf drills that we can take to the range to start using that new mobility that we got, and learning what it feels like to actually not sway, right? Because there's a motor control aspect to this. We got to make sure we're working on that. And we are on the road to mastery, right? So this is kind of what it takes at Integrated Rehab and Performance Center. This is the sequence of events that we usually go through to actually address the body and the swing in golfers who are struggling for different reasons, whether it's pain or strictly performance or just like performance inconsistency, right? They cannot stay consistent and have an efficient swing. Right, so this is what that road to mastery looks like. We draw lines, we figure out what swing characteristics you have. We do a TPI screen plus much more to really get down to the details of your body and your joints and your muscles. And we figure out where that correlation is to figure out. We see in the swing analysis how you swing. The movement and the biomechanics analysis tells us why you're swinging that way. And then we can correlate those two to help put you in a position to be able to combat those swing characteristics that you have, the ones that we identify to be maybe the ones that are giving you all the trouble. And then we can give you some simple drills just to make sure you understand what it feels like to start working towards correcting that swing characteristic. And again, we always refer to the swing to the golf pros and the swing coaches to really take that to the next step. We're kind of giving them a blank canvas, so to speak, where if they ask you to start doing some things, you can actually get into those positions without having to compensate elsewhere, right? So that's our whole mission here: get you out of pain, get you back on the golf course, and make sure that we can get you performing to the best of your ability. All right, so thanks for listening to this podcast on sway. There'll be more coming soon. Thanks for listening. Bye.